My name is Joseph Dayan. I'm a plastic and reconstructive surgeon specializing in facial paralysis, and I work at the Institute for Advanced Reconstruction.
Chris Lakhiani. I'm also a plastic and reconstructive surgeon. We're trained in reconstructive microsurgery, and we work for the Institute of Advanced Reconstruction, treating patients with all forms of facial palsy.
I love the ability to give hope to patients who feel stuck, who've been told in particular that there's nothing or it can be done, or there are limited options. It's incredibly fulfilling to be able to help somebody. All of us have been in a situation where we feel helpless, and to be able to help somebody is a privilege.
With facial reanimation, I like to say that though we're trying to give back smiles, we don't just make one smile, it makes a lot of people smile. It makes the family smile, their friends smile, the kids smile, but it also makes us and our whole staff smile too. So that's the most rewarding part of this, is bringing smiles to the community again.
In particular about treating facial paralysis, there's nothing like seeing somebody who cannot move their face and all of a sudden seeing a little flicker, and then a few weeks later seeing that grow into a smile, a blink, and restoring their face. It's like watching somebody who could not walk all of a sudden walk again. It's incredibly fulfilling and special moment.
Facial paralysis can refer to any condition that leads to the inability to move one or more branches of the facial nerve. This could manifest as an inability to smile, inability to close the eyes, inability to raise the eyebrow. In its worst case, people can have a very drooped appearance on that side. They may even have secondary issues such as difficulty with speech, swallow, or drooling. And these are all sorts of disorders and functions of facial paralysis that we look into during our examination.
The consequences of facial paralysis can be quite severe. It can lead to vision loss, difficulty eating, speaking. So there are multiple dimensions in addition to the stigma of not being able to move your face. Some of our patients become socially isolated. It can be a devastating problem. There are many causes of facial paralysis anywhere along the facial nerve from the brain, whether that's a benign or malignant brain tumor or malformation, whether it's a nerve sheath tumor along the facial nerve, or a parotid cancer, which is a salivary gland cancer in your cheek, or oftentimes we don't know the cause, often called Bell's palsy. This can be caused by a virus, by Lyme disease, or unknown causes, sometimes after pregnancy. So there are a variety of causes for facial paralysis, critical to come to the diagnosis in order to fashion a correct treatment.
The symptoms can include inability to raise the eyebrow, inability to close the eyes, loss of your blink reflex, inability to smile, loss of lower lip tone. Patients may have change in their speech, specifically with their B's and their P sounds, lodging of food in the cheek, or drooling. Some patients with certain types of facial palsy, specifically if you had Bell's palsy, may have noticed that they have ear pain or change in their ear ringing, or even taste in their tongue. So there can be a variety of symptoms, but generally they will all manifest with some sort of inability to move one, or in some cases both sides of the facial muscles. Bell's palsy, specifically facial paralysis from a viral illness, and usually those patients will say, I have ear pain or ringing in my ear, and I notice that one side of my face is no longer working. They're treated with steroids and antivirals at the time of that, and we encourage everyone as soon as they have this to go to your emergency room, be treated and evaluated for this, get initial imaging. 80% of those people will spontaneously resolve in part or in full within 1 year. However, nowadays, we really encourage folks to come see us early, because those who don't resolve, we don't want them to wait a full year. We'd like to be plugged in to see them earlier, because after a certain amount of time, the surgical interventions that we can offer to have a really full and robust and dynamic return of facial motion diminish. So although certain types of facial paralysis may go away on their own, it's very important that you have a reconstructive microsurgeon on your team helping you through this, so that in the case that it's not progressing the right way, that we're right there in your court. And for non-Bell's palsy due to virus cases, those patients should be seen very urgently, plugged in with a reconstructive microsurgeon so that surgical planning can begin, because otherwise Once a certain time point elapses, the surgical intervention becomes much more invasive, and we lose a lot of the fluidity and dynamic motion that we could otherwise restore to a person.
I would say a good rule of thumb, this is very general, is at 6 months, if you're not seeing any facial recovery, you should consider reconstruction and definitely seek attention of a specialist in facial reanimation.